our topic is about the drug affecting the function of uterus. In this lecture, we are going to discuss about the hypothalamus, its function and its releasing hormones, the female reproductive system, the menstruation cycle, the mechanisms, and in the last, we will talk about some prescription of these drugs. So our body regulates the reproductive system by releasing the hormones from the hypothalamus. The hypothalamus has anterior loop and posterior loop. From anterior loop, it releasing the six trophic hormones, in which the adrenocorticotropic hormones, the thyroid stimulating hormone, gonadotrophic hormone, in which the follicle stimulating hormone and luteinizing hormones are included, and the prolactin and growth hormone. These six hormones are releasing by the anterior loop of hypothalamus. And from the posterior loop, it releases the oxytocin and antidiuretic hormone, which is also known as vasopressin. So here we have the drugs that affecting the function of uterus. We have two kind of these drugs: the drugs that strengthen the contraction of the uterus and the drugs that weakening the contraction of the uterus. The drugs that strengthening the contraction of the uterus, it included the oxytocin and desamino-oxytocin, the ergometrine and methylargometrine, and the prostaglandin 2 and prostaglandin F2 alpha and misoprostols. And the drugs that weakening the contraction of the uterus, it included the paroxetine, which is also available by the name of phenoterol, and the magnesium sulfate, which is also the classification of antidysphatic drugs. Here is the complete review of the classification of drugs that acting on the uterus. The uterine stimulants act by increasing the tone of the muscle of the uterine wall. It induces or facilitates the labor. It decreases the postpartum hemorrhage, and it induces the abortion. And the uterine relaxant drugs, it is also known as tocolytics, which means toco means childbirth and latex means terminate. So it inhibit the or stop the premature labor during the pregnancy. These four are glycoprotein hormone, in which the luteinizing hormones, follicle stimulating hormone, thyroid stimulating hormone, and human chorionic gonadotrophic hormone are included. The human chorionic gonadotrophic hormone is also known as the pregnancy hormone, and this is very important. And as you are seeing, like these two chains, alpha chain and beta chain, they both are identical to each other, but the beta chains are unique and confirm the biological specificity. For example, the human chorionic gonadotrophic hormone, these are releasing in the first trimester of the pregnancy, and it act on the thyroid gland. The thyroid stimulating hormone, it act on it, and it increases the production of the free thyroxine hormone. Okay, now let's talk about the female reproductive system. It consists of the vagina, the cervix, the uterine wall, the two fallopian tubes, and the two ovaries on each side. So inside the ovary, there are hundreds of thousands of the follicles. From the first day of menstruation cycle, a few follicles begin to grow at the same time, but stop growing around the day 7, except the one. In the normal menstruation cycle, one dominant follicle will grow containing one egg, and the follicle will get bigger until it ruptures at the ovulation, which then releases the egg. This is around 14 days after the beginning of the human menstruation cycle. So here we are discussing about the menstruation cycle. The menstruation cycle consists of 28 days. So first 7 days are of menstrual bleeding, and it is also known as the follicular phase. In follicular phase, the maturing follicles are present, and in ovulation phase, the ovum eject into the abdominal cavity. And the luteal phase, it acts on the endometrium wall of the uterus, and the endometrium is the inner epithelial wall of the uterus along with its mucous membrane. The endometrium consists of the basal layer and the functional layer. The functional layer has many sections and it has a special kind of the tissues around it. It has a sticking property, like ovum is easily attached to it, and then it causes the ovulation and causing the pregnancy. During the 12th day of the menstruation cycle, the maturing follicle releasing the high concentration of the estrogen level in the bloodstream. The main estrogen is estradiol. The high concentration of the estradiol is active on the hypothalamus, and from the hypothalamus, the anterior pituitary lobe secreting the luteinizing hormone and follicular stimulating hormone. The high concentration of the luteinizing hormone and follicular stimulating hormone causing the ovulation. And during the luteal phase, the progesterones are releasing by the ovum, and the high concentration of the progesterone in the luteal phase, the progesterone convert the endometrium to its the secretory stage to prepare the uterus wall for the implantation. During the implantation and gestation, the progesterone appears to decreases the maternal immune response to allow for the acceptance of the pregnancy. So what is ovulation? Ovulation is the ejecting ovum into the abdominal cavity. It reaches into the fimbriae, and the fimbriae catches the ovum and it pushes into the fallopian tube. From the fallopian tube, the the mature ovum, so-called oocytes, is able to fertilize for only 20 hours. So if the spermatocytes are present in this time, then it causes the fertilization. So how spermatocytes are formed? During the mating, a man produces the 2 to 5 milliliter of sperm, and from 150 millions of spermatozoids, several thousands only reach the one into the place of fertilization to fertilize the single egg, and the rest of them will die. The normal fertilized egg, which is also known as the zygote, it travels and reaches into the uterine wall, and it happens only during the 6th day, and it start releasing the human chronic gonadotrophic hormone, and during the 12th week of the pregnancy, the human chronic gonadotrophic hormone start releasing at its peak level, and after 12 weeks to onward, it start decreasing the amount of releasing the human chorionic gonadotrophic hormone. So let's talk about the stages of pregnancy. First, I will tell you about the placenta. The placenta is a temporary fetal organ that begins developing from the blastocysts shortly after the implantation. The stages of pregnancy included the first trimester, second trimester, and the third trimester. The first trimester starts from 0 to 12 weeks. The second trimester starts from 13 to 28 weeks, and the third trimester starts from 29 to 40 weeks. The important point that should kept in mind about these three trimester is that in first trimester, the baby first heartbeat is at about 8 weeks, and in second trimester the gender reveals, and in third trimesters all the organs finish maturing. Okay, now the posterior pituitary hormone releasing the oxytocin. The oxytocin is work by increasing the concentration of calcium inside the muscle cells that control the contraction of uterus. Increased calcium increases the contraction of uterus. The oxytocin is a non-peptide hormone that has a central role in the regulation of partition and lactation. There is oxytocin receptor OTR signaling and its role in the myometrium during the pregnancy and in labor. So here is the review of the oxytocin mechanism. From posterior pituitary, the oxytocin releases and it promotes the uterine wall contraction, and hence it is also acted by the uterine stimulating hormone. So here are the antral, parental doses and half-life of oxytocin. The parental doses of oxytocin are 10 units per milliliter, and its half-life is about 1 to 6 minutes. The Posterior pituitary hormone oxytocin, its role in postpartum hemorrhage and labor induction and incomplete or inevitable abortion. And in labor induction, you can see 0.5 to 1 unit per minute intravenous nitrate, 1 to 2 m unit per minute Q15 to 60 minutes until the contraction pattern reached that is similar to normal labor. Usually 6 minute unit per minute may decreases the dose after the desired frequency of contractions reached and labor has progressed to 5 to 6 centimeter dilation. And in incomplete or inevitable abortion, it's 10 to 20 milliunit per minute, not to exceed the 30 unit per 12 per hour. The side effects of the desamino-oxytocin in the therapeutic uses, desamino-oxytocin does not usually cause a significant side effects, but in the mother, the uterine cramps also when used in low doses, uterine hypertonicity, tetanic contraction, uterine hyperactivity with uterine and vaginal tissue ruptures, nausea, vomiting, hypersalivation, increased blood pressure, tachycardia, arrhythmia, and also the death is possible, and the risk of disseminated intravascular coagulation. The important term about the Apgar score is Apgar score is a test given to a newborn baby soon after the birth. So the oxytocin causes the decreases in the amount of Apgar score. The side effects of the desamino-oxytocin in the therapeutic uses, desamino-oxytocin does not usually cause a significant side effects, but in the mother, the uterine cramps also when used in low doses, uterine hypertonicity, tetanic contraction, uterine hyperactivity with uterine and vaginal tissue ruptures, nausea, vomiting, hypersalivation, increased blood pressure, tachycardia, arrhythmia, and also the death is possible, and the risk of disseminated intravascular coagulation. And in the fetus, the bradycardia, arrhythmia, aphaxia, acute fetal hypoxia, staining of amniotic fluid with meconium, and death is possible. And in newborn babies, there may be a joinous retinal hemorrhage. The recommended dosage for the desamino-oxytocin is 25 to 50 units buccal tablet every 30 minutes or as necessary. Okay, now we are discussing about the ergoid alkaloids. They are also strengthening the contraction of uterine wall. So the mechanism of ergoid alkaloid structure, they have similar to the biogenic amines and non-epinephrine, serotonin and dopamine. The vasoconstriction is produced by an agonist activity, and this effect varies with the different vascular bed. Hyperthermia and uterine stimulations are other effects. The uses of the argometrin. The argometrin is used in the prevention of the postpartum hemorrhage while it acts at the alpha adrenergic dopaminergic serotonin receptors. It exerts on the uterus and other smooth muscle cells. The argometric and methylcometrin are these two drugs of ergoid alkaloids that are using for the contraction of the uterus wall. So now the antral doses, parental doses, and half-life of these two drugs. Argometric, its central doses are 0.2 milligram oral tablet. Its parental doses are 0.2 milligram per milliliter, and its half-life is about 30 to 120 minutes. Methylar cometrine, its parental doses are 0.2 milligram per milliliter for intramuscular injection, and its half-life is same as 30 to 120 minutes. Okay, now let's talk about the prostaglandins. Prostaglandins are also causing the strengthening of contraction of the uterus wall. The prostaglandins E2, also known as the dinoprostron, and the dinoprostron antral doses are 100 milligram vaginal inserts, and its half-life is about 2.5 to 5 minutes. And carboprost PGF2 alpha 0.5 mg per 3 gram endocervical gel antral doses, and the parental doses of carboprost PGF2 alpha 250 mcg 1 milliliter intramuscular, and the half life is about 2.5 to 5 minutes. Prostaglandin F2 alpha is a prostonide monocultures. Pharmaceutically termed carboprost is natural occurring prostaglandin used in medicines to induce the labor as an abortion. The misoprostol is the fourth drug that causing the strengthening of the contraction of uterus wall. Its central doses are 100 microgram and 200 microgram, and 1 microgram is equal to 1000 milligram, and its half-life is about 20 to 40 minutes. And the induction of labor of misoprostol, the induction of labor of misoprostol is 25 microgram intravaginally, and then repeat at the intervals, and not to exceed by 6 hours. And the postmortem hemorrhage, that include the prophylaxis 600 microgram, and the treatment is 800 microgram, and the treatment of incomplete abortion is 600 microgram Buckley 1. The side effects of the misoprostols included the stomach discomfort, the feeling very thirsty or hot, unable to urinate, heavy sweating, and hot and dry skin. The enteral doses of misoprostol is 100 microgram, 200 microgram, and its half-life is about 20 to 40 minutes. Now about the tocolectis. Important indications for B2 adenoreceptors agonist is tocolysis with the aim to reduce the premature labor and fetal mortality. The beta 2 adenoreceptors are dominant, and 80 to 85 beta 2 versus the 15 to 20% beta 1 adenoreceptors in the pregnant woman in the uterus, especially in the progesterone's dominant uterus. They mediate the muscle relaxation. In addition, there appears to be a positive correlation between the myometrial and beta adenoreceptors density in the lipophysites of pregnant women. Here are the enteral parental doses and half-life of the drugs that weakening the contraction of the uterus. The first one is partocystin. Partocystin essential doses are 15 milligram tablet, and its half-life is about 5 minutes. And the magnesium sulfate, its parental doses are 40, 50, and 50 milligrams per milliliter, and its half-life is about 5.2 hours. The magnesium sulfate act as a smooth muscle relaxant, possibly by the blocking calcium-mediated contraction, decreases the acetylcholine releases from the neuromuscular junctions and reducing the histamine-induced air spasms. With doses of 20 and 40 microgram phenoterol, sub-maximal uterine relaxation times of 7.3 and 7.9 minutes were obtained. Subjective side effects such as palpitations and restlessness. So the last and the most important topic is about the prescriptions. How to write a prescription in a right format is very important. So firstly, the sign of this RX is about the treatment, and firstly you have to write the patient name, his address, and the prescription is telling about the pharmacist about the drugs. Here I have written about the prescription about misoprostol. In the last you have tell about the date and do your signatures.